Hi there, my name is Ashley and I work on the communications team at Children's Wisconsin. The expansion of COVID-19 vaccines available and those who are eligible to receive them is welcomed news. While we know it will take time and patience as the rollout continues, this is a critically important step in our fight against COVID-19. That said, we know there's a lot of information out there about the vaccines, perhaps even more misinformation about the vaccines. Last week, a group of experts answered your questions related to children and the COVID-19 vaccines on a live stream. Today, we're going to answer questions related to myths about the COVID-19 vaccinations. Was the vaccine developed too quickly? Are there long-term side effects? Do I need the vaccine if I already had COVID-19? Will the vaccine alter my DNA? We will answer those questions and more throughout this conversation. Please continue to submit questions in the comments throughout this discussion. We plan to cover as many of them as we can. The experts joining me today from their homes and offices are Dr. Smirti Khare, President of Primary Care for Children's Wisconsin, Siobhan Robinson, Certified Child Life Specialist at Children's Wisconsin, and Brittany Syversen, Nurse and Patient Care Supervisor at Children's Wisconsin. All right, let's jump in with our first myth. We're going to be talking about 12 myths today. Myth number 1. The vaccine is not safe because it was developed too quickly. Let's start with you, Dr. Khare.
Thanks, Ashley. Yeah, this is one that I've heard a lot. And yeah, there are a couple of really good data points that we have now. And there's millions of individuals who have received the vaccine, both in our country and across the world. And, we're seeing the safety profile of the vaccine since we've been giving it. So that's good news. The clinical trials have been reviewed by many different countries and many different agencies. And they've really shown that these vaccines are safe as well. And so there's a lot of review going on around these vaccines that allows us to say that they're safe. But I think probably the best news around all of this is how effective they are. So the large clinical trials that were done for Pfizer and Moderna, which were the first 2 vaccines that were really approved for emergency use by the FDA, and now Johnson & Johnson has a vaccine that was just recently approved. All of them had significant number of patients in the clinical trials, enough for us to be able to have insight into the safety profile. And so that was good news. And probably even better news is the vaccines were really effective in avoiding hospitalizations and deaths related to COVID-19 disease, which is really very reassuring. The Pfizer and Moderna have an effectiveness of above 95% in decreasing this higher end of the disease and reducing the number of infections in general. And Johnson & Johnson's about 85% effective. And the other thing with Johnson & Johnson, it also is effective against some of the variants. And so all in all, great effectiveness of vaccines with limited side effects. So that's good. So why did this happen so quickly? They didn't start from scratch. There was technology and research that was going on in the development of vaccines for a long time. And they layered on the COVID-19 viral infection to this, and that allowed us to go faster. And there are 2 other really important points. One was the fact that there's so much prevalence of disease right now in the community that being able to find comparative data became easier because we had so much prevalence of disease. And then the other really important point is how easy it was to get volunteers for the studies. So usually when you're doing a clinical trial, it takes a while to get enough people to volunteer to be part of the clinical trial. And, thank you to all these wonderful people around the country who really volunteered to be able to do this research. All of that got us to this point faster. So yes, it was faster than usual vaccine development, but absolutely for all the right reasons.
Okay, I think we're going to stay with you for myth number 2. Myth number 2 is there isn't enough history of mRNA vaccines to know that they are completely safe and that they won't have long-term side effects. Can we have you talk about that, Dr. Khare?
Sure. And, so as I mentioned, the vaccines got to market faster because we had some infrastructure around it. And the mRNA research has actually been going on for a very long time, over 30 years. And it's been the basis of a lot of vaccine trials, like they've tried it for influenza, Zika, rabies, and again, slower vaccine development around those diseases for all of the reasons I mentioned before, not enough prevalence of disease and not enough volunteers. And so so while we don't have things that are out there successful, the research has always been there. And then the other area that mRNA is researched extensively is in cancer treatment, in finding ways to target specific cancer cells. And so this technology has been used for a while. And what we do know is there's not a lot of, there's no indication that there's long-term side effects from this, from using mRNA. So, traditional vaccine development often requires us to grow things in the lab to make the vaccine possible. This is rapidly reproducible, and we are able to really just get there faster. So it's been easier to get to the clinical trial numbers that we needed.
Okay, very interesting. Myth number 3, I already had COVID-19, so I do not need the vaccine. Siobhan, could you answer this one for us?
Sure thing, Ashley, for sure. So as we know that reinfection with COVID-19 is possible, you are advised to get the vaccine even if you have been sick with COVID-19 before. We're also uncertain how long people have that natural immunity after being affected by COVID-19. So this continues to be studied. Natural immunity also varies from person to person, just like most things. So even if you've had COVID-19 before, you should be provided the opportunity to get the vaccine when you are eligible.
Okay. So myth number 4 is that the side effects of the vaccine are severe. Brittany, can you talk about this one?
Absolutely. Actually, most people do not have serious side effects, although it has been reported some soreness at the injection site, a low-grade fever, or even a mild headache are sometimes reported. But just to keep in mind, these side effects are signs that your immune system is at work and it's doing its job to develop the response to the virus. And as more and more people receive the vaccine, we're gathering useful information, and it's affirming the safety and the low risk of significant side effects. But individuals who have had severe allergic reactions should consult with their physician. Vaccination sites are required to monitor individuals for 15 minutes after you get the vaccination. And those who have had allergic reactions to other vaccines, they're going to be monitored for a longer period of time, about 30 minutes. And also, the CDC is now using vSafe. It's a smartphone-based tool that uses text messaging and web surveys to provide personalized health check-ins after you receive a COVID-19 vaccine. The fact that ongoing data is being collected on a larger scale and has the use of cell phone technology is just allowing us to understand the side effects much better and faster than with previous new vaccines.
Fantastic. Okay. Myth number 5, the vaccine will give me COVID-19. Siobhan, could we have you answer that one?
Absolutely. So the vaccines actually do not contain a live virus, so they cannot give you COVID-19. Some people think that the mild side effects they have from the vaccine mean they're sick, when actually the body is doing its job, and that's working to build its immunity. There are several different types of vaccines in development, as we are learning with the new Johnson & Johnson's vaccine, and all of them teach our immune system how to recognize and fight the virus so that doesn't cause COVID-19. Sometimes this process can cause symptoms, such as fever or body aches, but that's your immune system doing what it's supposed to and building that protection. It's also important to remember that it can take a few weeks for the body to build immunity after the vaccination. So that means it's possible for someone to get sick just before getting the vaccine or just after getting the vaccine. And that's because the body hasn't had enough time to build that protection.
Okay, that makes sense. Okay. Myth number 6, COVID-19 has such a high survival rate. Why do we even need the vaccine? Dr. Khare?
Right. And so, I think Yes, while many people have gotten COVID-19 and gotten better from it, I think it's a very sobering number when you have more than 500,000 people who have died from COVID-19 related complications, and millions more who have had the disease. And now we're understanding more and more about people who've had what we call the long haul COVID-19, where they have long-term, symptoms that resulted from the illness. And so it really is a very impactful disease. It's probably one of the most contagious diseases that we've seen. So much about this was not known, and so it spread rapidly. It still does, and it's something that is just a very sobering statistic to know that it is now the third leading cause of death in the United States. So vaccinating vaccination is one of the ways that we can actually stop the spread of the disease. You've heard all of us talk about please wear a mask, social distance, limit your gatherings, wash your hands. All of those things are important. Vaccination is a very, very important new sort of step in this process to decrease the spread of the disease. All of us want to get back to the things that gave us joy. Get our kids back to school. We worry about them being out of school for so long. Get our businesses back open, and get back to semblance of life as it used to be before the pandemic. And vaccines are one of the ways to get there. So it's the way that we can achieve herd immunity.
Okay. Myth number 7 is the vaccine will alter my DNA. Brittany, could you answer this one for us?
Oh, sure. Thanks, Ashley. That's a great question. So the vaccine cannot alter your DNA. The mRNA, it's a message. So your body reads it and it'll identify and be able to fight COVID-19 virus, meaning you're not going to experience the severe illness from it in the future. The vaccine does not enter and it does not alter your DNA. The vaccine does not alter the nucleus of the cells where your DNA lives. And also, mRNA, it cannot change the DNA or your genes. So think of it like this. The mRNA is a lyric to a catchy tune. So you might not be able to remember the words from memory, but when that song comes on, you start singing along. So the mRNA actually degrades in your system, but your body remembers what to look for. So think of that as the song. And when the COVID-19 virus enters your body, your immune system will remember how to attack it. And it's also important to note that mRNA is broken down quickly by cells, meaning that the vaccine doesn't stay in your body.
Okay, I like that. That was fun with the song analogy. Myth number 8 is the vaccine causes infertility or miscarriage. This is something we get questions about quite a bit. Dr. Khare, could you answer this one?
Sure. This again, you're right, Ashley. We have heard about this a lot, the concerns around this. So the original clinical trials for Pfizer and Moderna did not include, actually had pregnancy as an exclusion factor. So the numbers of women that subsequently joined the clinical trial and got pregnant were limited. So, there's a limited amount of data that's available around pregnancy or, miscarriage or infertility and all of those things. And so that's sort of where some of this stems from. So when the early data came out, there was some concern about the safety profile. So what's happened subsequently is that, women who are pregnant and fit into the category of being eligible to receive the vaccine, like healthcare workers, if they chose to get the vaccine, that data became available. So since we've started vaccinating, there's many women who are, who are currently pregnant who were able to get the vaccine, and we're starting to see that safety data come through. So the American College of OBGYN is saying that it's safe. I have some weird echo. They're also saying, and they're really pointing out that COVID-19 disease is dangerous for pregnant women. we know that they have a much higher risk of having complications from COVID-19. And so, when you think about the risk-benefit profile, it seems that it would be the right decision to make sure that women are getting vaccinated. And so this is an area that's still being looked into. The CDC has said, the FDA is saying it's safe. But we are definitely saying, if you have a question, please talk to your physician so that you can make the decision that seems right for you.
Okay. All right. Myth number 9 is we do not know what is in the vaccines. Siobhan, can you take this one for us?
Sure can. So we do know what's in the vaccines. That information in detail had to be shared and released to the FDA and was publicly available before the vaccine got emergency use approval. We also know that there's no microchips or tracking devices including in the making of the vaccines.
All right. I think that's a hint at a myth we'll get to in a little bit. All right. Myth number 10 is we are better off building natural immunity to the virus. Dr. Khare, can you take this one for us?
Sure, and this sort of, plays off the previous answer that I had around, is it important to get the vaccine? And really what herd immunity means is that we have at least 70%, more than 70% of the population is safely immunized against the illness. And so 70% of the population would have to get sick. And that would be the sort of burden that society carries for us to not consider the vaccine. And when as we've talked about the death rate, while many people survive, there is a high death rate associated with this. So many people would die, and that is not a circumstance we want to have. So natural immunity is, the vaccine is allowing us to get immunity and get to that herd immunity status that we all want to. And this is one way of doing it without people having to get sick for us to get there.
Okay, myth number 11 is this is just like the flu. COVID-19 is just like the flu. Siobhan, could you take that one for us?
Absolutely. So while there are some similarities, COVID-19 and the flu are very different. First, COVID-19 spreads far more quickly than the flu. Second, the mortality rate is higher for patients with COVID-19. And third, adoption of the flu vaccine every year helps keep more people healthy.
Okay. And our last myth before we jump into some questions here is myth number 12. The vaccine includes a microchip. Brittany, can you talk to this one?
Sure. I think Siobhan had mentioned this as well, but just wanted to say that the vaccine, it does not contain any kind of microchip.
Okay. All right. So the three of you have been having these conversations and correcting misinformation with patient families throughout the pandemic. So you've had months and months, almost a year at this point, talking about it. As the viewers here are having these conversations with others in their lives, like their friends and family, what recommendations do you have for them? Dr. Khare, let's start with you.
That's a great question, Ashley. I probably would say that the most important thing is to really just have an open mindset and be willing to listen and hear. Every one of the interactions is an opportunity to just really understand where people are coming from, where they may be getting their information. I think the hardest thing about all of this last year of our lives has been COVID-19 was a new illness for us. And it was an unpredictable illness that we were learning rapidly about as we were going along. And so in most circumstances, people are used to actually having medical professionals having a lot of knowledge about the illness and being able to tell them what to expect and what not to expect. And, frankly, we didn't know. We were learning every day. And so the recommendations changed along the way. And that causes a lot of confusion. So I get that. So, that's that's one of the things that, is true of this illness. It's true of the vaccine. And so no question is unacceptable really in the circumstances. Like, you should expect questions. And, every question allows us to think about things that people need to know and want to know to be able to build trust in the vaccines and trust in knowing how to work with this illness and how to prevent from getting it.
Okay, thank you. Siobhan, do you have any tips for our viewers?
I do. Maybe one of the big ones, I have a little echo too, is avoiding pressure. Nobody likes to be told or sold what to do. And while we know that we need approximately 70% or more of the population to get the vaccine for it to truly be effective, shaming and pressuring someone is probably not going to get them to get the vaccine. It'll probably just push them away further. And then also understanding that we all have our different circumstances around our opinions about the vaccine. So it's important to be aware of some significant societal factors that might impact trust in the medical community and vaccines in general, especially among communities of color. We know in the United States, Black and Latinx people are almost 3 times more likely to die from COVID-19 than white people, according to the CDC, and that's due to economic disparities.
Okay, yeah, that's important to remember. Brittany, what about you? What tips do you have to share?
I would just say, share what's important to you. Nobody can take away from your experience and what's important to you. And then just try to keep that door open for conversations. Just invite continued conversations in the future. And then lastly, just model the behavior that you want to see. So tell people that you got the vaccine and share your experience. Don't sugarcoat it. If your arm was sore, you had a low-grade fever, just say so. Just be your authentic self, share your experience, and give others permission that it's okay for them to do the same. The more and more people get vaccinated, the more others will be comfortable to do the same.
Okay, great tips. Thank you, guys. All right, we're now going to jump into questions provided by the audience. A quick reminder that we will be trying to answer as many questions as possible now, but we will continue to answer questions in the comments after this conversation. Let's start with some questions that were submitted on the event page over the last couple of days. So one of the first ones is, can the vaccine cause breast cancer? I'm going to loop that in with another question we received that was about how the vaccine can affect mammograms. Dr. Khare, do you want to take a shot at this one?
Yeah, actually, when you asked the question about breast cancer, that's what I thought about. And so there's recently something that the CDC put out about mammograms. And so the concern is that, if you get the vaccine in your arm, your lymph nodes that live in your armpits are the ones that's where the beautiful immune system happens. That's where your body learns how to fight against the infection. And so there's a risk that some of those lymph nodes may be inflamed and larger when you're getting a mammogram, and that could cause confusion in terms of that's one of the areas that they're looking at in a mammogram. And so the recommendation from the CDC is to wait 4 to 6 weeks after your COVID-19 vaccine before you get a mammogram, so there's less confusion. And there's also guidelines of what to do if you've had the mammogram sooner, and what follow-up tests and such to do. So it's not a breast cancer risk. It's a possibility that the mammogram and the lymph nodes might confuse the picture and create difficulty in diagnosing breast cancer. So that's really the concern that's out there.
Okay, thank you. I think we're going to stay with you for the next couple questions here. If Brittany or Siobhan want to jump in, just let me know. How long does the vaccine effects last? So how long is the vaccine effective?
Yeah, so we're still waiting and learning about that. So, because this is under emergency order, we are going to continue. The clinical trial is continuing, if you will, and they're continuing to monitor the people who are in the original clinical trial to look at how long their immunity is lasting. And so far, so good, but we're not sure what that number is yet. And so that's something that will continue to be studied.
Okay. And then we've heard about mutating viruses along with COVID-19. Will there be a third dose of the vaccine that's needed due to this virus mutating?
Yeah, so probably the most important thing around that is to know that that's normal for viruses to mutate. I mean, it's something that we do know, we have experience with. We've influenza is a big example where the virus can change a little bit every year, and so what we so probably two most important things are that if we can decrease the spread of the virus, if we can decrease the burden of the disease, there's less chance of it having the ability to mutate. So, I mean, I'm giving a very simplistic explanation for that, but that's one way of looking at it. And so getting this under control is one of the good ways to decrease the mutations. And secondly, every vaccine that's out there is going to start to test its effectiveness against the variants that are out there. So this is, again, an area that we're continuing to know and understand. And so whether we'll need further doses or not is going to depend on the effectiveness of the original doses of the vaccine, how long the immunity lasts, and coverage for variants. So these are areas that will continue to be studied.
Okay. And then one that I think we addressed actually earlier in the conversation, but it's a good one to ask and reinforce, is the vaccine backed by the FDA?
Right. So the FDA has given emergency use authorization to these vaccines, which meant that there was enough data to be comfortable and safe about this vaccine being given to lots of people, but it's also asking for further data to continue to evaluate the vaccine. So it's very much backed by the FDA, and the FDA also has expectations that this data will continue to be submitted so we can continue to know and understand the effectiveness of the vaccine.
Okay. So let's jump into some questions that were asked while we were talking here live. We're seeing some questions, another thing that I think was addressed earlier in the conversation, but important to reinforce, about people with allergies. Should those people be getting the vaccination? Dr. Khare, you want to kick us off?
Sure. So very specifically, if you have had a reaction to this vaccine product, then you should not get it again. That is the only true contraindication. If you have the possibility of allergic reactions to any of the ingredients of the vaccine, which I think it was Siobhan who said, that information is publicly available, something to definitely look through and make sure that you are aware of that. That would be another contraindication. If you've had allergic reactions in the past and you've had anaphylactic reaction in the past, it is something that we want you to be careful about. And so when we are doing vaccination clinics, we normally ask everybody to stay there for 15 minutes to be observed because it's new and we want to make sure if you're going to have a problem, we're there for you. If you have a history of allergic reactions, we ask you to stay for 30 minutes. Mm-hmm. So to really be able to create that safe space and to be able to understand whether you need help or not. And so that's where we are with allergies. And so certainly if you have a history of allergies, we are recommending that you connect with your physician and have that conversation so that you know how you're going to deal with this.
Okay, and then the last one submitted live here, we're getting a lot of questions about different people with different conditions and whether or not they're eligible to get the vaccination as of right now. Dr. Khare, can you talk a little bit about what's going on with eligibility?
Mm-hmm. So the state of Wisconsin, our Department of Health and Human Services with advisory councils actually has worked on a phasing plan. And so our phase 1A was, healthcare workers. Phase 1B just started on March 1st. It expands further. And so right now, the people who are eligible, and this is information that's available at the DHS website. It's a great place to go and look and see who's eligible for the vaccine. I think pretty much if you put in COVID-19 eligibility in the state of Wisconsin, you'll get the information well publicized. And so, we have healthcare workers, essential workers, 65 and above, and educators, firemen, police, there are different categories of folks that are there. So we are not at the high risk, less than 65 years of age, non-healthcare workers, non-essential workers right now. So that group, will continue to be phased in as vaccine becomes available.
Okay. I think that is all of the questions we received live here. So we're going to move on to closing here. Do you guys have closing thoughts you'd like to share with the audience? So let's start with Dr. Khare.
I think I've said this a few times. This was a hard year for all of us. I mean, think back to last March, and our world really shifted and changed. And the vaccine's a ray of hope. It really gives us a moment to say, hey, we can beat this. We can get past this illness and this pandemic. And so it's an exciting time. And it's absolutely okay to have lots of questions. And, this is what your healthcare team is here for. We want to make sure that everybody stays safe. And we really, really would like to encourage people to get their vaccines so that we can all, get to a better place here.
All right, Siobhan, do you have any closing thoughts?
Yes, I do. I think from a personal standpoint, and recognizing that I am a person of color, I just want to kind of echo kind of what Dr. Khare said in terms of leading with curiosity. We talk about that a lot at Children's and having questions. And it's okay to have those questions, and it's okay to, not feel as comfortable as you would when we have vaccines with such great information and data around it. And then this is something that we have to get comfortable with, and it takes time, and it's okay to have a change of heart. That's something that actually happened to me, and I wasn't on board initially, and it did take my own education and learning from the experts around me at Children's to go forward and get that vaccine. And so I just want to encourage people to educate themselves and keep the conversations going, uplift and encourage one another, and not lead with judgment, but curiosity.
I love that. Thank you. Okay, Brittany, what about you? Closing thoughts?
Oh, I think Dr. Khare and Siobhan just really summarized things super well. I would just say, as a reminder to everybody, just wear a mask, wash your hands, and stay 6 feet apart. But otherwise, thanks you guys so much for having us.
Ashley, can I add something?
Yes.
This thought crossed my mind. One of the things we worry about most in pediatrics is preventive care that might have been missed because of the illness and because of just fear coming into healthcare spaces. And so we want kids to get immunized. We want to make sure that they are safe against all of the other childhood illnesses as well. And so bring your kids on in for their well visits and for their immunizations and any visits that you have with the specialists. Please seek medical care because that's important. And be kind to each other. It's been a tough year, and so keep that all out there.
Yeah, the vaccine's given us some hope, but yes, it's been quite a tough year. All right, thank you all for taking the time to answer questions. As always, the team at Children's Wisconsin is here to support you, so please do not hesitate to call your child's doctor's office, use MyChart messaging, or our online urgent care. If you have any questions about Children's Wisconsin or the COVID-19 vaccination, please visit childrenswi.org/coronavirus. There you can find all kinds of resources, from details about children's locations and when they're open to blog posts on topics like this one. Thanks everybody for watching.